Population control strategies. Four methods of population control are in effect today: legislation, coerced surgical sterilization, covert chemical sterilization, and bacteriological extermination. In this lesson, we will look at each and every one of them to see how they stack up. It is a comparative analysis of the depopulation methods devised by the international system and employed thus far. For each method, I present a country or a region to illustrate its effectiveness with facts and figures. China has chosen legislation to tackle its population problem and has passed the one-child policy in 1978. India has chosen coerced surgical sterilization, and to this end, the nation's medical authorities involuntarily sterilize women, and to a lesser extent men, by performing millions of tubal ligations on women and vasectomies on men. The West has chosen covert chemical sterilization, and to this end has adulterated the basic elements of life: water, food, beverages, dental, cosmetic and consumer products, with endocrine disruptors, thus depopulation poisons, to subvert fertility and promote morbidity, so as to limit births and manage deaths, and in this fashion bring births and deaths in perfect equilibrium, which leads to stable populations. And Africa was saddled with bacteriological extermination because it lacked the political will and the infrastructure to willingly adopt covert chemical sterilization or coerced surgical sterilization methods. Taking on man's primal instincts is a difficult task. The instinct to breed is second only to the instinct to live, and the global depopulation policy has challenged both. Not surprisingly, the results are mixed. Let's look at China's one-child policy first. Since its introduction in 1978, the one-child policy has prevented the birth of 400 million Chinese. Without it, China, which currently has a population of about 1.4 billion, would have had a population of 1.8 billion, thus 30% more. Prior to its introduction in 1978, Chairman Mao encouraged large families and opposed family planning programs, at least publicly. During the 30 years that Mao Zedong was in office, from 1945 to 1976, China grew from 540 to 940 million people, and thus nearly doubled its population. But the reality is that during the last 10 years of Mao's leadership, the country introduced covert chemical methods of sterilization and reduced the nation's total fertility rate from 6 to 3 children per woman. After Mao's death, the one-child policy was passed. I suspect Mao resisted legislation so as not to destroy his legacy. Had the government of China done nothing and the same growth levels would have continued, China would now have nearly 2 billion people and none of the prosperity that has made it the second most powerful economy in the world. Market-based economic reforms coupled with population controls have catapulted China to unprecedented prosperity. Its gross domestic product took off as soon as the one-child policy was implemented, and in the ensuing 3 decades, it grew 20-fold. China now has a per capita income of nearly $17,000. There is no question that in purely economic terms, the one-child policy, coupled with free market reform, has been a phenomenal success. But what are the social and political drawbacks of the policy? To better understand the following data, readers will need a brief lesson in demographics, the study of populations. A country's population is the result of 2 primary factors, namely how many people are born in any given year and how many die. thus the balance between fertility and mortality. The population explosion started when our improved medicine and quality of life enabled nearly all children to survive birth and the first critical years of life, while at the same time extended people's lives into old age. To stop the population explosion, governments began adopting family control measures to lower fertility and set as their target an average of 2 children for every woman, which is known as replacement level fertility. The average number of children born to every woman of childbearing age is known as the total fertility rate, abbreviated as TFR. And the ideal TFR is 2 children per woman, or replacement level fertility. The idea is that if every couple on Earth has no more than 2 children, then the population will neither grow nor decrease. It will merely be replaced with every new generation and will remain stable for all times. Before governments began interfering with their people's fertility, the TFR of most nations was anywhere between 3 to 6 children per woman. And this meant that the population grew at a rapid pace and doubled every 20 to 30 years. The demographic profile of a country is represented graphically by a population pyramid, which shows the distribution of various age groups in a population, with the youngest age group at the bottom and the oldest at the top. A natural population growth always forms a pyramid, as the population is growing steadily, thus widening its base. But once a population is interfered with and the number of children born starts to decrease, the base of the pyramid becomes narrower and the population eventually stabilizes. The graphic representation of a stationary population looks like a haystack rather than a pyramid. If the average number of children born per woman drops below 2, then the bottom of the pyramid becomes in time thinner than the middle, which denotes that the population is decreasing. Let me repeat that sentence. If the average number of children born per woman drops below 2, then the bottom of the pyramid becomes in time thinner than the middle, which denotes that the population is decreasing. The graphic representation of a population that is declining then looks like a mushroom. This demographic transition from an expanding to a stationary to a contracting population is visible at a glance as the pyramid becomes a haystack and then a mushroom. This transition cannot happen without active, long-term human intervention. To achieve this demographic transition, it takes anywhere between 3 to 5 generations, thus anywhere between 90 to 150 years. This gradual and slow process requires a government's firm and sustained commitment, and by necessity will straddle many changes of leadership. Once a country commits to achieving the demographic transition, it is in for the long haul and for a tough battle. Most developed countries today are in phase 3 or 4 of the demographic transition, as they have covertly chemically sterilized their people for 60 years, whereas most developing countries are in phase 2 or 3, as they have adopted population control measures more recently. China's population pyramid in 1930 looked like that of any other country on Earth at the time, as no country had adopted population control measures. But once China introduced its one-child policy, the number of children born decreased rapidly compared with previous cohorts, and its population pyramid began to narrow at the bottom. China is currently in stage 3 of the demographic transition, and by 2025 its population will start contracting from a peak of about 1.5 billion people. China will have achieved its demographic transition in 70 years, or less than 3 generations, which is a tremendous accomplishment given the size of its population. This shows that legislating population control and openly enforcing it is a very effective way to fight the population explosion. But there are drawbacks to China's method of combating population growth. The negative consequences of China's one-child policy are as follows. For one thing, police state enforcement. To ensure compliance, draconian measures have been used, especially in the countryside, where the authorities have forced women to abort and have even demolished the homes of peasants who have had a third child. Even though rural Chinese are allowed 2 children, if their firstborn is a daughter or suffers from physical disabilities, mental illness, or mental retardation, whereas urban Chinese are allowed only 1, the policy meets with greater opposition in the countryside than in the cities. Pregnancy without a birth permit is considered out of plan and therefore illegal. The one-child policy is in great part responsible for China's police state and its massive and rigid bureaucracy. Local governments direct officials to punish non-compliance with heavy fines, termed social maintenance fees, which force many couples to choose between undergoing an unwanted abortion and incurring a fine much greater than the average annual income. Children may go without a household registration, which is called hukou, because they are born out of plan and their parents do not pay the mandated fees. Lack of a valid hukou raises barriers to access to social benefits, including subsidized healthcare and public education. To ensure enforcement, the Chinese government employs 300,000 officials. To help out with enforcement, the China Family Planning Association has 92 million members, organized into more than 1 million branches. Officials are given a financial incentive to meet abortion and sterilization quotas, leading to extortion and coercion. Family planning bureaus conduct pregnancy tests on married women, and those who miss a test will be fined. Some local governments offer rewards to informants who report population planning violations. Village party staff face a penalty of 1,500 yuan, which is the equivalent of about $230, for each woman with 2 children whom they fail to sterilize. Conversely, they are promised a reward of 500 yuan, which is the equivalent of about $80, for each tubal ligation that they see through to completion. Teachers who violate birth quotas are at risk of losing their retirement benefits. Another consequence is that is forced abortions and sterilizations. So, millions of aspiring mothers are forced to undergo abortion or sterilization. 13 million abortions are performed each year at an average of 35,000 a day. How many of them are forced is impossible to tell. Since 1971, Chinese doctors have performed 336 million abortions and 196 million sterilizations. They have also inserted 403 million intrauterine devices, and 55% of all women in China have had an abortion. The psychological stress women face leads to a suicide rate for females that is 3 times higher than that of males. China is in fact the only country in the world, along with the small island nation of Sao Tome and Principe, where the suicide rate is higher for women than for men. Suicide is the leading cause of death for adult women living in rural China and accounts for 1/3 of all female deaths. 56% of the world's female suicides occur in China, but only 19% of the world's population lives in China. And 500 women commit suicide in China each day, usually by ingesting pesticides. Another consequence is a lopsided male-female ratio due to abortion of female fetuses. More than half of all abortions in China are the result of prenatal sex selection. Many parents prefer a male child to a female and will abort until they have a male fetus. This has led to a gender imbalance, and as a result, about 50 million Chinese men will be unable to find brides by 2020. Although such a large number of unmarried men could cause social instability, it also means that a good percentage of China's men have been excluded from the procreation chain, even though unintentionally. China's State Population and Family Planning Commission reports that 118 boys are born for every 100 girls. In rural areas, where boys are preferred to girls because they can help with farming and carry the family name, the sex imbalance is even greater, as 130 baby boys are born for every 100 girls. To rectify or address this trend, the government introduced the Care for Girls program in 2001 to promote the birth of girls in rural areas through financial incentives of about 100 yuan or $13 each month per girl. Also, local education fees are waived for girls. Another consequence is strict control of population movement. Since rural Chinese are allowed to have 2 children while urban Chinese are not, the government exercises strict control of internal movements and prevents rural dwellers from migrating to the cities. China's household registration system, the hukou, acts like an internal passport and allows rural Chinese to move to the cities only for temporary work or post-secondary studies. The children of farm workers who have migrated to the cities are not allowed to enroll in city schools and must attend schools in their villages. There are circa 130 million children in China who are separated from their parents through the requirements of the hukou system, which are in great part dictated by the demographic objectives of the one-child policy.